Hey y'all, it's Danielle from Black Business Boom and Black Owned Nashville, and we are live with Dr. Aleta Simmons, our Black dermatologist here in Nashville. Super excited to have her back again this month, and I'm excited because we're gonna give some love to the Black men today, which is very important that we show love to our Black men. And I feel like a lot of times our topics are leaning towards more towards the ladies, so. Today, we're going to be talking about some of the skincare concerns that Black men have and some solutions for them. So let's jump on in. Hey, Dr. Simmons, how are you?
Good. How are you?
I'm fantastic. I'm happy to have you, and I'm sure everyone's happy to see you because they've probably been calling over there to Vanderbilt in shock to hear that you're no longer there. So
Yes.
I'm sure everyone has some questions about that, but we will make sure that we get to that before we wrap up today. But let's jump into it. What are some of the concerns that you hear from Black men when they're coming to see you?
Most commonly, razor bumps, bumps on the back of the scalp, and sometimes cysts. Men get cysts in their beards and hair loss. Those are the top ones.
Okay, let's tackle them. Let's talk about these hair bumps, 'cause I think that's definitely one that we've seen in the comments a lot as we've gone live for the Black men getting the razor bumps. What can they do? What should they be doing to prevent them and or treat them?
So we have to start with the cause, and the hair is the cause. When we shave our hair tends to be curly, so it wants to curve back into the skin. And this happens in women too, because there are some conditions where women may grow more hair in the chin or the neck area. So this goes for those conditions too. So I start with one, the simplest thing is to grow out a beard, right? But some men have jobs or other circumstances, or they just don't like to have a beard where they can't have one. So for that, we have to talk about skincare, skin prep, and what type of razor you should be using. So you always have to prep the skin. Just like women before we shave our legs, you want to make sure the skin is like moisturized from water. So making sure that you have some warm water, like in a warm towel, or even some steam if you have it from the shower and shave after that. And then making sure you prep the skin with a shaving cream, right? Because that's going to help the razor glide more. Now, we know that there are electric razors and then handheld ones that aren't automatic. And so for those, I recommend the Gillette Skin Guard razor. And I like that one because it doesn't pull the hair completely away, completely out of the skin. The razor is formulated where it has a piece in the middle of it that kind of gives some give as you glide across the skin. And that creates a point on the skin to where it's more blunt. And when it grows, there's a little bit of stubble still left, so it's growing out of the hair follicle instead of having the opportunity to grow into the hair follicle, giving you the bump and irritation.
Oh, okay. So it may not feel as smooth afterwards, but it also may not cause, the irritation or the bump afterwards.
Yes.
Okay. Well, we gotta choose. We gotta make some decisions sometimes.
Yeah. Also, laser hair removal is a good option. For some people, they may not want to remove their beard completely with laser hair removal, but you can do hair reduction where you reduce the amount of hair that you have, where you're shaving less often, having less irritation to make your skin be more on the healthier side. So you don't have to remove the whole beard. You can do laser hair reduction instead of complete removal to help with this condition too.
Okay. Is that the same? Would you give the same advice for the back of the neck?
It can be an option for the back of the neck, but we also need to treat that medically. So, for people who have razor bumps on the face, I also prescribe medications in addition to treating the skin with changing behaviors around shaving. But for the back of the scalp, men get folliculitis, which are hair bumps around the hair follicle. But sometimes that condition can develop into another condition called acne keloidalis, where those bumps harden and turn into scars like keloids. Sometimes they stay small bumps, but sometimes they form large round areas across the back of the scalp. That needs more medical treatment, including topicals, sometimes orals, and injections with steroids. And when I mean injections with steroids, I mean into the actual keloid, not systemically.
Okay. All right. We learning some things. And actually, while we are definitely talking about Black men and their treatment, I think a lot of this is relevant for even a lot of the women that may be listening in who may need some help, for themselves, but also if they're raising young men, that may start to experience some of these things as they are, growing into men. So great advice. I think one of the other things you mentioned was a hair loss, one of the
Yes.
other concerns. So let's talk about hair loss, because I know that's one that, as we get older and we see, men and women will lose hair at all ages, and we'll see some people old, much younger than others that'll start to lose hair. So what is the cause? What are some of the causes, and are there ways that we can prevent hair loss? Do we just roll with it and accept that it's part of life?
I think sometimes men feel like it's a part of life. There's nothing I can do about it, but there actually is. So the most common is male pattern hair loss, which is, you see the man who's lost the hair on the top of their head, or they've lost their hairline. And so when you start to notice that, some men can notice it as early in their 20s. You want to look to your parents, does your dad have it? Uncles, even, are there women in your family that have pattern hair loss? Because that's where you may be getting it from. It can be genetic. So you want to start treatment early, just like any type of hair loss. There are topicals, so we start with those first. We can do minoxidil, which is is generic for Rogaine. And we can also do combination topicals that are prescription, oral pills, to help combat it. Sometimes the pills have side effects, so you want to be in close communication with your doctor if you have side effects to the medication. And then also, once you're on medication and you're not losing any more hair, you can be a candidate for hair transplant, where hair is taken from the back of the scalp and replaced in those areas where you've had thinning. So early intervention is important. Men also can be affected by hair loss conditions that commonly affect women, especially in the Black community: centrifugal cicatricial alopecia, which just means centrifugal, round in the center of the scalp. Alopecia means hair loss. That can mimic male pattern hair loss because it's in the center of the scalp. I had a young man who I thought had male pattern hair loss, and I was treating him. And one day I was, examining his scalp. I like to touch all the scalps because sometimes the skin feels different, and you can feel and see when the skin is fibrotic or scarred. And he had some very early signs of that. And so we decided to biopsy it. And he, in fact, didn't have male pattern baldness, but he had the centrifugal cicatricial alopecia. So we had to change his treatment course. So you want to make sure that you're seeing someone who's actually fully examining your scalp, so that you can make sure you have the right diagnosis and treatment. So men, there's help for your hair loss. You just got to come see us early.
I love it. I love it. Like, soon as you start seeing it, and again, I think some men are just like, it runs in my family, or it's part of life, and I'm just gonna live with this, and it is what it is, So I'm just gonna move on with life and hold on to it as long as I possibly can, or go ahead and cut it off. So there is help out here. So we talked about, the razor bumps. We talked about the hair loss. What are some other common issues that men are dealing with when it comes to their skin and hair?
Men that play sports often come in with fungal infections, because it's very common, right? If you're using a common space with other people, usually between the toes, in the growing. So you want to recognize that early and make sure you get on some treatment, but also maintenance treatment to make sure that it doesn't come back.
What can you do? Are there things that you can do to prevent that?
So when you shower, you want to make sure after you cleanse your feet and the growing, you want to make sure that you are drying those areas, because fungus likes dry, warm places. So when we put on our socks, put on our shoes, what is that? Dry and warm. Put on our clothes. The growing is just breeding places for fungus. We all naturally have bacteria, viruses, and fungus on our skin, but we don't want to allow it to grow. So you want to make sure you dry those all the cracks and crevices. You want to make sure.
Uh-oh, I think we lost Dr. Simmons. Dr. Simmons, are you there? Can you all still hear Dr. Simmons, or did you all lose her as well?
I lost
there
you
we
for
go.
a second. There
we go. You're back. So make sure you dry.
Yeah.
That's very important. And I think a lot of times, men will go to like the gym and be working out and then just kind of go run errands or whatever it might be. And yeah, it's a lot
Up in the shower.
A lot going on. Okay, this has been fantastic. Anything else you want to leave us with for the men that are tuned in?
Find somebody you feel comfortable with, whether it's that first initial conversation with your primary care doctor. We might even just need to start there with men. Find a doctor, somebody who you can trust.
There we go. There you go.
Any of your concerns with, get your screenings, and your skin is a part of that screening. So don't forget about your skin and what you may have going on. If something doesn't look right, tell your primary care doctor. They'll help you get in with a dermatologist if needed, so that you can make sure you're covered head to toe.
And I think that's really important because, again, we've spoke a lot about, noticing different lumps or rashes or, different things on your skin that could be indicators of other medical issues that you may be having. And so for men out there, it's important that you do have a primary care doctor, that you do see them regularly, that you do get your blood work done, and that if you are noticing something different on your skin or anything different with your body, that you're going to the doctor. We have to take care of ourselves. We need our Black men to survive. We need our Black men to be healthy and to thrive in our communities. And like you said, our skin is part of that, and how we show up in our communities and part of our confidence as well. So I think it's just really important. So I'm really glad we had this conversation today. So again, I know a lot of folks are wondering, where is Dr. Simmons? I know folks were like, she's leaving. I don't know what I'm going to do. So tell people how they can find you and how they can keep up with you as you are transitioning.
So follow me on social media, Instagram and Facebook at Get the Skinny, GETTHESKINE. I'll be announcing on there what my next steps are, how you can make an appointment. I have a wait list right now. So just stay tuned for what's next. And I haven't left Nashville. I'm still here. I actually really miss my patients. I've developed a community with my patients, and I miss seeing them and hearing from them. So listen, just drop me a hello and let me know, how you're doing. I would appreciate that.
I love it. Wonderful. Again, Get the Skin E on all social media, as well as gettheskine.com is where you can find Dr. Simmons. Make sure you go and sign up on the list on the website, and you can also reach out via social media. This was a great conversation. Thank you so much.
Thank you.
All right. Thanks for tuning in, everyone. Have a wonderful